Welcome to the Thyroid Fixer podcast. I'm your host, Dr. Amy, and we're diving deep into the world of hormones, especially for all you fierce women in perimenopause and menopause, and everyone struggling with hypothyroidism. So if you are battling weight gain, you're feeling like shedding those pounds is an impossible feat. If you're dealing with plummeting energy levels, gut-wrenching fatigue, or a libido that seems to have left town, then you're in the right place. And let's not even start on the hair loss. If these symptoms are sounding all too familiar, you have found your tribe. My goal is to educate, empower, and shake up your world. Remember, I want you to embrace every inch of that badass woman that you truly are. So if you're ready to dive in and fix things, let's go. I have recommended Quicksilver Scientific products for years, so I can definitely attest to their quality, their effectiveness. And then there's Dr. Chris Shade. He is a genius when it comes to developing liposomal delivery systems that are unmatched. You cannot match his delivery method anywhere in the world. He is a groundbreaking scientist. So when we're looking at detox, specifically heavy metal detox, support of the liver, his detox protocols are amazing. The push couch liver detox is unparalleled. You don't need these lengthy, expensive detox programs. You just don't. Do the push catch, do the liposomal glutathione, throw in some GABA L-theanine to calm the nervous system, get great sleep. That's all you need. And here's the other kicker that I really love. He has a drink easy bundle. So we all know that alcohol is very, very toxic, but we're social creatures. Some of us like to go out and be social, have a beautiful glass of wine with a red steak, right? Well, with the Drink Easy bundle, you can do that without having the hangover effect the next day, without crushing your liver. It gives total support with milk thistle, bitters, liposomal glutathione, once again. So you put all these together and your body is literally set up to detox from all the harsh environmental chemicals and toxins that we are bombarded with on a daily basis. So you're going to go to quicksilverscientific.com/Dr. Amy and use the code Dr. Amy. That is going to give you 15% off your order. That's going to allow you to try the glutathione, the push catch, the Drink Easy bundle. So you're going to go to quicksilverscientific.com/DRAMIE and use the code DRAMIE for 15% off. So this is going to be a game changer for you, and you can probably hear the excitement in my voice. The latest introduction, the latest member of the family to the Fixer line is Metabolism Fixer. And this, oh my God, I formulated this just for all my people out there that need to lose weight, that need help in the weight loss department, that can't lose weight no matter what they do, that feel like they have a slow metabolism, and that might be thinking of trying all those peptides out there, you know, the Beverly Hills soccer mom drug of choice for weight loss peptides. Or even if you're on them already and you're like, man, these are really expensive and I'm still not losing weight, add in Metabolism Fixer. Here's what I did. I took the power of T2, which increases your basal metabolic rate while you are sitting there watching Netflix. You're burning fat while you're watching Netflix. I combined it with a very unique patented ingredient called Suppressa. Suppressa has multiple clinical trials backing its efficacy in reducing your appetite, decreasing snacking, and providing way more control over your food intake. It is amazing. We also see improved emotional well-being, just decreased food cravings all around, reduced hunger, and weight management. Add on top of that, we have green tea extract, we have purple forest purple tea extract, both of which affect the metabolism in a very positive way without the jitters of normal fat burning supplements out there from the 1980s and 90s, right? The ones that made you feel like you're having a heart attack. You will not have that in any of my supplements, Thyroid Fixer or Metabolism Fixer. But Metabolism Fixer, ooh, yeah, we kicked it up a notch. It is in powder form. so you can drink it through your day. It's going to flavor your water. We got orange crush and refreshing citrus. I love them both. It is going to keep you under control all day long. So you throw a couple scoops in your water bottle in the morning, throw a scoop or two in your water bottle throughout the day. You will have fat burning and appetite control the entire day for what? An eighth of a price of the peptides? Oh my God, you can't go wrong. So grab some Metabolism Fixer today. Please let me know how you do on it. I am super excited for you. Super excited. Dr. David Brownstein, I told you off camera too. I am just so blessed to have you on as a guest because I've been wanting you as a guest for years now. And I talk about the importance of iodine on the show, but I want everyone to hear it from the expert on iodine. So welcome and just thank you for being here.
Well, I'm so happy to be here, Dr. Amy. I've been a big fan of yours over time and, let's talk.
Cool. Sounds great. Well, you know what? I love your story. So I don't start with guest stories on every podcast, but yours is pertinent because I've actually told your story multiple times on the show. I'm like, Dr. David Brownstein had a practice in Michigan, and I go on and on. He kept seeing thyroid patients. So I want to hear it from you. I want them to hear it from you. So how'd you get here? How did you start diving into iodine and thyroid and all those things?
Didn't start off this way. I didn't start off a conventional holistic doctor. I've been practicing holistic medicine now 30 plus years, but I went to med school residency believed everything I was taught. Came from a conventional household. We didn't question it. Growing up, we didn't question anything. We just went to the doctor when we were sick, took whatever they told us to take. We didn't do anything. I didn't take a vitamin growing up. So I was in med school and residency, and I wanted to be from the beginning, I wanted to be a family doctor, modeled after my family doctor. I grew up with a severe case of asthma, and I thought that I was sure I knew how I was going to die in this world with not being able to breathe because I had a lot of ER trips and just, terrible asthma growing up. And so I wanted to go I spent time with my family doctor because of that. And I went to med school and residency to model myself after my family doctor. And I started practicing regular medicine and telling people don't take vitamins, don't, do anything different than what I was taught. And around 6 months into that, I started to have an uneasy feeling, started to lose sleep for the first time in my life for a couple of nights. And after 3 nights of not sleeping very well at all, I'm getting up and getting ready to go to work. And I told my wife, Allison, that I don't want to be a doctor anymore. And she's known me since I was 18 years old. It's all I wanted to do was be a doctor. I thought that was my calling in life. And she said, what's wrong? And I'm like, I'm not helping anyone, just putting them on too many drugs. I'm not spending enough time with them. I am putting them on drugs that are not treating the underlying cause of their problem, having them putting them on more drugs to treat the problems from the first drugs. I said, I can't do this for the next 30 years. And she said, what are you going to do? And I'm like, I don't know. She said, do another residency. And I'm like, no, that's not happening. So I was floundering a little bit, and she was pregnant. We had a baby coming in 2 months. I was going to be a partner in this practice that I was at, and had a lawyer, was negotiating in a buy-in for a partnership right at that time. And so I saw this patient at work who's been bugging me for a while to meet his chiropractor. Now, at that time in my life, I never met a chiropractor. I never referred to chiropractors. I used to tell people, don't go see them,
right.
even though I never met one. I didn't know what the philosophy was. I didn't know anything about them. And, I was trained that way. So his wife and my wife worked together. So we had done some things socially with him. And he kept telling me this chiropractor was really helping him, much more so than adjusting. He was putting him on vitamins and minerals and diet changes. So in my lack of sleep and anxiety, I did call that chiropractor and set up a dinner meeting and for the following week. And that day came around, and I came home from work and told Allison, I'm not going, it was a waste of my time. And she said, it's too late. You already scheduled it. You have to go and be nice, as I was walking out the door. So I go meet him. His name was Dr. Robert Radke. He was super smart. He knew more functional biochemistry than I did. He was rattling off pathways and, what are the cofactors of these pathways. And let me tell you, I got an A in biochemistry at the University of Michigan. I got an A in biochemistry at my med school. I thought I was real smart in biochemistry. I didn't know anything. So he brought me a book at that meeting, Healing with Nutrition by Jonathan Wright, who's an allopathic physician. And I took that book home, read it till the middle of the night, and I, was just jacked up about what I had learned from him, what I read in that book. Called my dad before I left for office that morning and said, "Can you come in the office and get a couple of blood tests?" My dad had his first heart attack at 40, a second heart attack at 42. Over the next 20 years, bypass surgery, angioplasties, 12 medications for diabetes, blood pressure, and heart disease, and I already said diabetes. And he looked awful. It looked like he was going to die at any moment. His coloring was terrible. He was having continual angina for 20 plus years. And he couldn't do anything because he was so sick. So my dad comes in the office. I drew 2 blood tests on him. I drew a thyroid level and a testosterone level. And I was taught in med school to just draw a TSH for thyroid levels. I drew a whole thyroid panel this time.
Yeah.
And I get his blood work back a few days later, and his testosterone levels are below detectable limits. No one had bothered to check it. It was so low, just wasn't reading on the lower part of the lab limit. And his thyroid levels were in the reference range, but in the lower part of the reference range. So I put him on 2 things, natural testosterone and natural thyroid hormone. And within 7 days, his 20-year history of angina melted away, never to return. Within 30 days, his cholesterol stuck in the 300s on medication, fell below 200 without changing any of his bad habits. And my dad had a lot of bad habits, which he never changed. He went from pale and pasty to pink coloring in his face. He went from having angina continually and popping nitroglycerins continually to no angina. And as soon as I saw those changes, I'm like, that's what I want to do in medicine. And I went to the partners and I said, I need to leave. And they said, why? And I said, well, I want to do I want to practice holistic medicine. They said, what's that? And I'm like, I don't know, but I'm going to have to figure this out. They said, why don't you do it here? And I'm like, no, I need an office where we all, the file clerks, the people answering the phones, the nurses, everybody is on the same page. We're all the same philosophy. And so I left. From that moment on, every patient got a whole hormonal and nutritional evaluation. And once I started ordering the right thyroid tests and looking at people more appropriately, I started diagnosing all these thyroid problems, particularly hypothyroidism and underactive thyroid. And within 10 years of making that switch, I have about 3/4 of my patients on thyroid hormone. They're doing better. They're reporting to me they're doing better. Their labs look better. And it was nagging at me. Why do so many people need thyroid hormone to feel good? Because the big complaint I hear from people is they're fatigued.
Right. The weight gain. Yeah.
Number one's fatigue. Everyone's tired out there. But, you put them on thyroid hormone or get their thyroid balanced, and many times it gets better and weight gain gets better and, the hair gets better and all that stuff. But I didn't think we were designed by our maker to have to put 3/4 of the world on thyroid hormone just because they're getting a little bit older. That didn't make sense to me. So what I learned from Dr. Radke, the chiropractor, was to look at functional biochemistry. And so I would go back to the biochemical pathways of how does the body make thyroid hormone? And I would, you'd see the cofactors there like magnesium, selenium, vitamin C, B vitamins, and iodine. And you can't make thyroid hormone without without all these cofactors. But what kept coming up, when I was reading about thyroid hormone production was iodine. And so I would try the cofactors. I would try selenium. I'd try B vitamins. I'd try iodine, small, medium, large amounts. Nothing worked as well as thyroid hormone. And it was a continual frustration for me. And then around 10 years into that practice, I read a letter to the editor from one of the journals that I got where a doctor had developed an iodine loading test. Because before that time, there was no good testing for iodine. And his name was Dr. Guy Abraham. He was in California, and I called him. He became interested in me because of where I practiced in Michigan. And Michigan is the Great Lakes area. It's, states that surround the Great Lakes, Michigan, Indiana, Illinois, the 4-letter state to our south that starts with a lowercase O, not capitalized O, a lowercase O.
And, yeah, we have to say it that way.
And so these areas have very low iodine in their soils.
And Pennsylvania. Don't forget about me up in Lake Erie. That's part of the
Ontario on the other side, Canada on the other side. But our soil is one of the lowest iodine levels in the entire world. And this was discovered in the early 20th century when the country was settling from east to west and expanding from east to west. And there was a goiter epidemic in the Great Lakes area. And a goiter is a swollen thyroid. The thyroid sits here, and people have big goiters. It sticks out of their neck, and you can see them, and you can, palpate them and, size them and all that stuff. Mm-hmm. But there was a huge goiter epidemic in the US with 30 to 50% of women suffering from goiter. And the goiter epidemic made its case to the highest levels of our government because there was an animal problem at that time. As the country was settling from or moving from east to west and, expanding, there was a worry that the human population was going to outstrip the ability to provide enough food for this population because the farm animals were having problems and they weren't growing to the right size. They weren't procreating correctly. And it was determined that farm animals were suffering the same iodine deficiency problems humans were. Their thyroids weren't maturating correctly, and a thyroid hormone interacts with every cell in the body, and they determined it was iodine deficiency. Mm-hmm. So there was a doctor outside of Cleveland who was tasked to do a study looking at the minimal amount of iodine in animal feed that would stop the procreating and the growth problem, or correct those problems, so the animals could procreate correctly and grow to the correct size. So he put varying amounts of iodine in their feed, and he found the minimal amount that stopped the problem. And he estimated that amount to humans by body weight. Mm-hmm. And that's how we came up with iodized salt. The easiest way to get iodine in a population is put it in salt. And that's what was mandated in the 1920s. So we came up with iodized salt, and it was hailed as the first public health miracle in the United States, and it was. It allowed animals to grow the right size. The goiter epidemic was better, and it was, it didn't cost a lot of money. It was pennies into iodized salt, and iodized salt studies were repeated in Michigan after Ohio, and they found the same problem. And then the government quickly recommended iodized salt for the rest of the country. And, really the interest in iodine kind of faded after that. But mm-hmm. that was a story of how iodine sort of came in. But in my practice, so Dr. Abraham comes up with his iodine loading test. He becomes interested in my practice. And I didn't know how deficient people were until I started doing the proper testing. And when I did the testing, I found over 97% of, back then hundreds, but now it's over 8,000 people are deficient in iodine. Most are severely deficient in iodine. And once I started using the right form of iodine in the right amounts, I was able to take 3/4 of my patients on thyroid hormone down to 1/4. I was able to take the average thyroid dose of 120 milligrams of natural thyroid down to 30 milligrams. Wow. And the only thing I did differently was really give them iodine. And so iodine's been sort of a mainstay of my practice for the last 20 to 25 years or so now. And that's how it started. And iodine's needed by every cell in the body. You can't manufacture in the body. You have to get it in your diet. Our iodine in our food supply has declined over the last 50 years, and iodine levels across the United States have declined about 50% inside of us, according to the National Health and Nutrition Examination Survey. And that's led to a plethora of health issues that we're facing today. And that includes cancer, all the endocrine cancers, which is thyroid, ovaries, uterus, breast, prostate, and pancreas. Mm-hmm. And fastest growing cancer in the US is thyroid cancer. Prostate cancer, probably affecting 1 in 3 men. Breast cancer, about 1 in 7 women. We all know people with pancreatic cancer, ovarian and uterine cancer, epidemic rates. And iodine deficiency, I don't know if it's the sole cause of this, but it's a big piece of that pie. But iodine deficiency could explain, why we're seeing such rises in this.
No, absolutely. And I've said this multiple times as well, that iodine is required by every cell of the body. But I want you to expand on specifically thyroid and then breast, because the majority of my listeners are women. And I don't think that they understand the importance, number one, of iodine for a proper functioning thyroid. Just like you said, you're seeing these patients reduce their thyroid hormone replacement by a decent amount and still not get those hypo symptoms back, even after reducing the thyroid hormone treatment. And then breasts. And I love your stories on breast cancers, the women that you have helped with that, the one woman in particular that had bromide coming out of her breast tissue onto her nightgown. So I want you to explain the importance of iodine with thyroid, and then we'll get into breast.
So iodine is an essential element. Every single cell in the body needs and requires iodine to function optimally. You can't make a hormone in the body without adequate amounts of iodine. The endocrine glands consists of tissue that release hormones. So thyroid, ovaries, uterus, breast, prostate, pancreas are examples of endocrine glands.
Mm-hmm.
And we were designed with an elaborate mechanism to be able to concentrate iodine in these glandular tissues against a gradient, meaning the tissues have higher amounts of iodine concentrated than what's in the blood. So there's a mechanism to move iodine from the bloodstream into the thyroid or the breast or the ovaries or the uterus. And it's an energy dependent process. It requires a molecule, ATP or energy molecules burned to do that. And you need a couple of sodium atoms to facilitate that process. So people need adequate amounts of salt when they take iodine or salt to move iodine into the right tissues. So iodine is an incredibly important substance. That's why there's this incredibly intricate mechanism to move it from low concentrations to high concentrations and store it there. And what iodine does in the glandular tissue is maintain the normal architecture. So if I call this the normal architecture, it's normal. There's no bumps, lumps, growths, or anything like that. That includes the thyroid, ovaries, uterus, breast, prostate, pancreas. And in iodine deficiency, in animal test tube and human studies, it's been shown that the first thing that happens is you can get cysts, such as fibrocystic breasts or cysts on the prostate, cysts on the ovaries. And if it goes on longer, those cysts can become hard and nodular. If it goes on longer, if you biopsy it, it takes a hyperplastic appearance, which is a precursor to cancer. This is the iodine deficiency continuum. And in animal test tube and human studies, iodine repletion is shown to not only halt this progression, but be able to reverse it. So the last 50 years, our iodine levels have fallen from the government checking us every 10 years or so, a portion of the US citizens, and the levels have gone down. And at the same time, our hormone cancer, the endocrine cancers have gone up, almost in, direct opposite to one another. So in regards to breast tissue, breasts are the second or third major iodine storage in the concentration in the human body. Thyroid's number one. Then it's either the ovaries or the breasts, number 2 or 3. You referenced a lady that was an interesting story. She had a metastatic inflammatory breast cancer, the worst kind. You get diagnosed with this, you're usually dead in a few months. She came to see me and she was given 3 to 4 months to live. And she had lesions all over her chest and throughout, her liver and elsewhere in her body. So I start working with her, and this was before I knew about iodine. This was near the end of that first 10 years when I wasn't really using iodine.
Okay.
We try it. It didn't work. I couldn't get people off their thyroid. I couldn't get them down on their thyroid. They didn't get worse. They just didn't get better. And I get frustrated with iodine and move on. It wasn't until I started working with Dr. Abraham that I learned about what I was doing wrong, and we can talk about that.
Yeah.
But so I treat her, and she's alive 2 years later. And although progressing, the lesions are growing. She's got more stuff coming out of her chest and, in her liver and in her bones. And, she's not able to do much. She's just not, she doesn't feel good and she's tired all the time and losing weight. And then I learned about iodine, and I do a study in my office where I checked 9 breast cancer patients versus 9 women who didn't have breast cancer. That was the only screening I did for that. And I measured 24-hour urine iodine uptake, which was Dr. Abraham's test. And I measured bromide and iodine levels and fluoride levels. The reason I measured those were iodine is in group 17 in the periodic table of the halides, which is on the right side of group 17. And the halides are all items that are similar to each other in the size and shape, and they can competitively inhibit one another, so that if you get bromide in excess, it'll kick out iodine. If you get fluoride in excess, theoretically, it could kick out iodine. Now, there's 4 halides: iodine, chloride, bromide, and fluoride. 2 of those halides are toxic agents with no known therapeutic value, and I'll throw fluoride into that category, along with bromide. And 2 are essential. We can't live without them. That's chloride and iodine. So you get chloride from salt, and you're supposed to get iodine from our diet, but that's gone down over the years. And, what the problem we've had is our overexposure to bromide. And bromide there's no known therapeutic value of bromide. It's in food and drink as brominated vegetable oil. It's in clothing as a fire retardant. It's in mattresses. It's in, if you're sitting on a cushion right now, which I am, I'm assuming it's probably got some bromide in there.
Yeah.
Bromide's easily absorbed into the body if you don't have enough iodine. And iodine's, if you get too much bromide in, bromide will kick out iodine. If you get too much iodine in, you can kick out bromide. So it's called competitive inhibition.
Mm-hmm.
So with this lady, I put her in this study and she took 50 milligrams of iodine on time 0. We measured her 24-hour urine afterwards. Then we had her do 50 milligrams a day for 30 days and then measured her levels again, or her halide levels again. So we did it time 0, 1 day after she started taking it, and then 30 days after she started taking it. What I found was for the breast cancer group, they had 50% lower iodine levels and 50% higher bromide levels as compared to the non-breast cancer ladies. And with this patient, she had really low iodine levels, lower in the average group of breast cancer patients, and really high bromide levels. She was a little bit higher. Mm-hmm. So I told her, she's in the middle of collecting this 50 milligrams a day, 30-day trial. And she calls me up about 2 weeks into it. And she says, I think I'm having a side effect from the iodine. I said, what's wrong? She said, my nightshirt's turning yellow over, where my breasts are. And she had lesions. She had lesions here from the inflammatory breast cancer. It was all over her chest wall. Mm-hmm. So I said, why don't you come in? So she came in the office. I said, bring your nightshirt. So she brought the nightshirt. The nightshirt was yellow right here on the inside. The outside was white. Yep. The rest of the shirt was white. And her nails were all yellow. Now her eyes were yellow. She wasn't jaundiced, but right. She had the yellow coloring of her nails. It wasn't a jaundice coloring yellow. It was a odd yellow coloring. We're in the middle of the study. I don't have her results yet. I said to her, it looks like you've got bromide. I mean, that's the color of bromide, is this yellow. It's not a jaundice yellow. It's a bromide yellow. Mm-hmm. So I said, how do you feel? She goes, I feel great. Got more energy. I'm able to babysit the kids a little bit now. She goes, I haven't felt this good in years. So I said, why don't you keep doing it? We're doing the study. I said, why don't you take some Epsom salt baths, see if we can help this stuff come out. So she would take baths, and then she called me and said, my tub's got a yellow ring around it when the water comes out. Wow. She goes, but I feel better. So I saw her. I said, I want to see you in 2 weeks, right at the end of the study. I saw her in 2 weeks. The yellow was gone. And I took her nightshirt from that first visit. I was going to do a study on the nightshirt. I talked to Dr. Abraham about it, and we sort of designed the study. And then it wasn't he died yet. He did die, unfortunately. But so we're going to do the study, and I would fly out to California to do bench research with him, probably 4 to 6 times a year. Spend a long weekend in his lab. Mm-hmm. And he would teach me about iodine. He taught me about what I was doing wrong with iodine, and how to do it correctly and how to test for it, and made me a much better human being and a physician. So the next visit out there, he says, bring the shirt. Let's do the studies on it. We design it over the phone, how we're going to test this. And I lose the shirt. I literally can't find it. We were moving houses at that time.
Yeah.
I couldn't find it. So I looked for that shirt everywhere. I can't tell you. Shirt's gone. So I moved to my second house when that happened, and the shirt was gone. And then we lived in that house about 20 years. We moved to our third house, which I'm in right now. Mm-hmm. So we moved to the third house. I'm cleaning out things in my office, and in a cabinet shoved in the back was a plastic bag sealed with the shirt. So I find the shirt. So Dr. Abraham, unfortunately, had died, in the interim. Mm-hmm. So I was friends with Charles Hakala, who was a pharmacist who used to go to California with us, and we would do that bench research together. I said, Charles, I got that shirt, and he knew what it was immediately. So we basically carry out Charles had the ICP mass spec machine to be able to do the analysis at that time, and so when I lecture, I give these results that we took samples from the front of the shirt and 2 samples from the back of the shirt, the same size. We found these huge bromide levels in the front of the shirt, none in the back of the shirt. So she was detoxing bromide. The detox lasted about 2 to 3 weeks before it went away. And she ended up living 6.5 years. The cancer killed her. She had a really good quality of life till right at the end. My only regret with her was I should have used more iodine on her, that I know now. That's my regret. I didn't know it back then. But I saw the power of iodine with her, and that was really a cool experience.
That's huge. I mean, that's huge. And I'm checking in with you. How's your energy these days? How's your skin? How's your muscle strength? These are things that are very, very important to me. And I know just from research that after the age of 30, our mitochondria starts breaking down. And these are the powerhouses of the cell that provide us with muscle strength and better skin and abundant energy through the day. So I've added in something that I wanted to share with you, Timeline Nutrition's MitoPure. So when we look into research into healthy aging, it really focuses on that pivotal role that our mitochondria plays in our body. And without our mitochondria working at top notch, then health is just declining. And that's not what we want. Daily wear and tear on a mitochondria is inescapable, but we can do something about it now. Timeline Nutrition's MitoPure is the first supplement that has been clinically shown to replace and rebuild damaged mitochondria. And this results in a boost in cellular energy. And actually, research has shown that individuals experience an increase in muscle strength and endurance without even altering their diet and exercise routine. So, I mean, I can personally attest to feeling the difference. I am now going to ask you to feel the difference. So I invite you to go to timelinenutrition.com. They're giving my community 10% off of MitoPure if you use the code Dr. Amy. So you are going to go to timelinenutrition.com/Dr. Amy and use the code Dr. Amy, DRAMIE. So timelinenutrition.com/DRAMIE and use the code Dr. Amy at checkout. I've mentioned Dr. Lindsay Burks, and we've had her on the show before. I love her to death. And she's openly said that she's a DES daughter, breast cancer survivor, proponent of hormones. And I heard her on an interview with you on the iodine training you guys did together. And she said, I wish I would have known you earlier when she was going through her breast cancer treatment, or even she might have even mentioned before. Like, I wish I would have known about you and iodine previously, because maybe I wouldn't have even had to go through breast cancer. That might have actually saved her from going down that road. So, I mean, that really, those stories speak to the power and the importance of iodine. And I do want to get into the types of iodine, the testing, the dosing. But before we do that, I want to transition in back to the thyroid, because there's so many people out there. And I always give the stat. I think we're split maybe 60% in the functional community are pro iodine, 40% are anti-iodine. It might be even be 70-30. I don't know.
Those 40% are pretty loud, let me tell you, and they let me know it. And I hear from them all the time. And it's very interesting,
Well, I'm going to tell you, I have never taken down a podcast except for one. And that was one that an expert was talking about how you need to avoid iodine. And I don't want that message out there and I believe in dual opinions. Everybody, can have their own, but in this particular topic, there's too much research along the lines of the importance of iodine, just everything that you just said. We could go off the last 10 to 15 minutes and stop it there and say, okay, do you now see how important iodine is?
I'll say
keep going.
Let me say one thing before you ask.
Yes.
So I know who the researcher was.
Yeah.
And there is.
Yeah.
And here's the counter argument that they can't explain it because there's no explaining it. We know in medical studies, association doesn't equal causation. So just because I'm just going to make something up here, but because this neighborhood suffers lung cancer at 80 times the normal rate, doesn't mean they're suffering lung cancer because they have too many they have more evergreen trees on the lawn than the next neighborhood over, or they have more cars in their driveway than the next neighborhood over. Maybe they do. And maybe we could say that's an association, and we need to think about it or do further research, but it doesn't make it true. Right. So association never equals causation. Mm-hmm. But an inverse association disproves causation. So my argument to that gentleman and other, iodophobic individuals is, have iodine levels gone up or down in our population over the last 50 years? And The research is clear. Iodine levels have fallen over about 50% over the last 4 to 5 decades. Over those 4 to 5 decades, has all the cancers I mentioned earlier gone up or down? Has Hashimoto's or an autoimmune thyroid disease gone up or down? And all those things, cancer of the glandular tissue, which thyroid, ovaries, uterus, breast, prostate, pancreas, and autoimmune thyroid disease, Hashimoto's and Graves' disease have gone up skyrocketing during the times iodine has fallen. That alone disproves iodine as the cause of those rising illnesses.
Right.
Now, might be something else, but it ain't iodine.
Right.
And
right.
That's a simple counter argument that there's no really, they can't come up with anything with that.
So simple. And then even what you said before about the halides, we know that those halides are toxic to the thyroid gland. So fluoride, bromide, chlorine, they're toxic. So if they compete with iodine, it would just, again, we can bring in logic here and say, why wouldn't we want to push those toxic halides out so they're not doing further destruction to the thyroid gland or to any of the endocrine tissues?
Not that hard. It's not that hard of a concept. And there's 2 toxic halides, and there's 2 essential halides. And I would say we do better to keep the essential halides happy and get rid of those toxic halides. It's really not that difficult a concept.
Right. Exactly. So why do you think, is it just based on that false belief that since, I don't know, like where do they get the negative?
So where it comes in, if you Google me and you say iodine is like putting fuel on the fire for Hashimoto's and Graves' disease, you'll find my quote. That was from my first 10 years when I was afraid to use iodine. Not that 10 years, it was the first few years. And, it was not drilled into my head because there wasn't much discussion of any nutrients in med school, but it was really taught to us and solidified to us that nutrient deficiencies were a thing of you learned about nutrient deficiencies. You learned about beriberi with congestive heart failure and thiamine deficiency. You learned about scurvy and vitamin C and how Lind and the sailors in England, were dying because they weren't getting vitamin C until they put I think it was limes or lemon or limes on the boats and they got vitamin C and, corrected scurvy. You learned about iodine deficiency and goiter and that it was cured from iodized salt. And that was the end. There was really nothing about iodine. And then there's always articles out there saying iodine causes autoimmune thyroid disease. And I bought into it and I was afraid to use it for people with autoimmune thyroid disease. And when I started using iodine, I was a little afraid, maybe I'm going to be precipitating these things. But then, when I went back in the literature and looked, iodine was a treatment of choice for autoimmune thyroid disease in the early 20th century. And there's case history after case history after case history of right now in my practice, there's 7 of us seeing patients. We like when Graves patients come in. They're easy to treat. Graves and Hashimoto's forms from iodine deficiency. The treatment is given iodine as part of a holistic treatment regimen. It's not just iodine. It's getting their diet cleaned up, detoxing, correcting other nutrient and hormonal deficits. But those diseases usually rectify. I haven't sent a patient for radioactive iodine treatment in over 2 decades.
Wow.
And that's the treatment of choice in conventional medicine for treating an overactive thyroid. I've had to send 1 or 2 patients in 20 plus years for a thyroidectomy where the thyroid gland was such a mess, an infected mess, just couldn't correct with iodine. And that's been it. Everyone else has done really well. Anyways, there's a lot of iodophobic individuals out there. And unfortunately, it's still in the holistic world, which it shouldn't be there. And it just boggles my mind why it's still there.
I know, it drives me crazy. And I've heard, fears of a thyroid storm. And I guess if you started someone right out of the gate on 100 milligrams, you might get a thyroid storm. I don't know, but the anti-argument drives me nuts.
You only get a thyroid storm if they have an autonomously functioning nodule and you give them iodine. That nodule, which is not under normal control in the body, takes up the iodine, makes a lot of thyroid hormone. I've had a couple of patients, less than this many, in 25 years from that happening. And that's the risk of using iodine. And that's out there. And with proper use, sometimes the only way you diagnose it is give them iodine because it's not the easiest to diagnose. But then you take them off iodine and, you don't keep doing it. And really, it's a pretty safe and effective treatment.
So is it safe to say, you mentioned earlier that our maker didn't make us to have XYZ. And I'm even going to take that a step further, that God didn't create us to have nodules, goiters, growths, tumors. And I'll get a lot of patients that come in, they say, well, I have these nodules, but my doctor said, don't worry about it, just watch and wait. Isn't it safe to say that if you have a goiter / nodule, that's a problem? That's your thyroid gland saying, hey, I'm having an issue here that might need addressed. And that person is going to have symptoms that accompany that, correct?
So it ain't just your thyroid waving the hand there. It's, 88% of US women have fibrocystic breast disease. That is a precursor to breast cancer. That is iodine deficiency, period. End of story.
Mm-hmm.
Thyroid nodules are iodine deficiency, period. Ovarian cysts, it's the same thing. Pancreatic cysts, thyroid, ovaries, uterus, breast, prostate, pancreas. It's the same issue. I like the waving the hand. That's a good analogy. That's exactly what it is.
Yeah. Like, hello, pay attention to me, please. Thank you. Yeah, exactly. So if it's that important, now I'm going to transition into testing. Can't we assume if iodine is necessary for every cell in the body, why do we bother testing? Why don't we just all take it? Because we're probably all iodine deficient.
Well, iodine's an essential item that we need. Every cell in the body needs iodine, and there's not enough in our food supply right now. And then when you couple it with this overload of toxic halogens, bromide and fluoride, bromide, as I mentioned before, food, drink, and many consumer goods, including this thing, and fluoride, in our water supply and juices and alcohol and everything else they're making with public water supplies, that we are more iodine deficient than our predecessors were by far. Our iodine deficiency epidemic is way worse now than it was a couple generations ago. And that's why we're seeing all these problems. That's what I believe. And so I think that I'm not quite sure. I'm in the weeds now what your question was, or where you asked me that question.
Why do we test? Can't we just take it? I mean, isn't it safe to just take it?
Well, I'll give you a nuanced answer. I do a full hormonal, everyone in my office, there's 7 of us. We all do a full hormonal nutritional evaluation of every patient that walks in the door. So we kind of try and spot check things. But we got 97+% of people iodine deficient, most severely iodine deficient. I'm telling you, the only ones that aren't iodine deficient is they're taking iodine because they learned about it on their own, or they read my book and they're taking iodine.
Right.
So can we just take it? Yes, but iodine is best used as part of a holistic treatment regimen. I don't use it solely. Look, to make thyroid hormone, you need the B vitamins. You need B2 and B3 and vitamin C and selenium. If you don't have those, you're going to have the same issue of not making inadequate thyroid production with enough iodine. But iodine's sold over the counter. Vitamin C sold over the counter. Do I think everyone in the world needs testing for iodine before taking it? No. But I think to get the best results with it, it's helpful to work with an iodine literate healthcare practitioner who can guide you and test you and refollow up with testing, and then sort of adjust things depending on what's going on. It's always good to have an independent person looking over things. The worst doctor is your own doctor, is being your own doctor.
Oh, that's true. That's true. Well, when I'm working with my patients, I tell them to start slow and work their way up. And we'll get into dosing here in a moment. But I always tell them, you will know when you've taken too much for you, because I've done it. You just feel amped up. You feel like you drank too much coffee. You feel hyper for that day or for a couple of hours in that day, but it's going to wear off. I mean, we know that. It's like you'll be okay. You're not going into a thyroid storm. You just took a little bit too much iodine from what you need back down to that last dose that you took prior to increasing and feeling amped up. Is that accurate? I mean, is it true that you kind of know if you've taken a little bit too much?
Yeah. And look, sometimes I see people with, something screwy and they don't know it. They don't feel anything. It's variable, but again, the best way is to work with somebody. But look, I start sort of like lower doses and move them up. I mean, now I'm comfortable with it. I start, my usual starting dose is 25 milligrams.
Okay.
If they have endocrine disease, breast, ovaries, uterus, prostate, pancreas, thyroid, I'll start more. And if they have cancer of those tissues, I will quickly get them up to higher doses. And so that's kind of how I use it today, but along with, whole hormonal nutritional evaluation.
Okay. So 25 milligrams, really nice starting dose. I mean, even if you want to start 12.5 and then work your way up, but I'm a big fan of between 25 and 50. How high will you go for those with different endocrine cancers?
Some of the old literature, they use gram doses of iodine, some of the old literature, and people. St. Georgie, the discoverer of vitamin C, says he felt better at a gram a day of iodine, 1,000 milligrams.
Wow.
So I haven't used that much. I've used a couple hundred milligrams.
Okay.
My partner, Dr. Ng, he's had people on 500 to 700 milligrams who have severe cancers. We don't really know what the upper limit of dosing is. And if you have normal kidney function, you should be able to regulate iodine levels with even massive doses of iodine.
Mm-hmm.
Oh, we don't have iodine storage in our body. We don't have like a iodine pump, like a camel would have a hump of water.
Mm-hmm.
Iodine's used on a daily basis. And it's used up to make thyroid hormone, adrenal hormones, sex hormones, whatever it's supposed to do. And then you need more iodine coming in. So if you don't take it on a daily basis, it's 24 to 48 hours, you can easily become iodine deficient again.
Right. So let's say we have somebody that we're using a higher dose on, we're going to 200, 300. When you do the test, which is the provocation, the iodine loading test, and then the 24-hour urine, correct? Would you use that dose that they're at? Would you use that 200 and then measure their urine for 24 hours based on that loading dose? And then when you get those results, if it shows that, well, I guess so the provocation test, the test results to show that they are taking too much iodine would show very little being excreted, or would show more as being excreted. Explain the testing to us.
So here's the problem. The problem with that is we did the initial test on 50 milligram loading test, which I'll explain in a second. So I don't know what it shows at 100 milligrams or 200 milligrams, or when you take those doses, I don't know what to do.
Okay.
But so the iodine loading test, there's two ways to test iodine, really, that are accurate. One is just do a spot urine iodine test. Spot means you just pee in a cup, drop a probe in there and see what the iodine level is whenever.
Mm-hmm.
Now that test is only accurate if someone's not taking iodine, because once you take iodine, 98% of that oral iodine dose is cleared through the urine. We don't have reference ranges on spot urinary iodine tests for supplementing iodine. So levels go up really high if you take iodine here, because you're going to excrete 98% of it out. And the reference ranges aren't set up for that. The reference ranges are set up for a population that's iodine deficient to take minimal amounts of iodine. The RDA was set in the 1930s after, the Michigan and Ohio studies showing that the small amount of iodine corrected the goiter epidemic. The RDA was set up not for optimal levels of iodine, but for minimal levels to prevent goiter. That was it. But, I mentioned what the problems are now, the breasts, the ovaries, the uterus, the pancreas, all this other tissue needs iodine too. We're just really, the RDA was set up for the thyroid and the thyroid alone.
Mm-hmm.
So the iodine loading test is where you take iodine at a time, 0, let's say 6 a.m. You pee before you take it. You take it at 6 a.m. Then you collect 24 hours of urine until 6 a.m. the next day.
Mm-hmm.
You take that urine into a lab. They will drop a probe in there or put it through a mass spec machine, and they will tell you how much iodine, what the concentration of iodine in it is in that volume, and you can figure out how much you excreted. So let's say you take 50 milligrams in, if 98% is cleared through your urine, could be cleared through urine, through our testing and original studies of this, we found that when people are saturated with iodine, you have iodine receptors all through your body. They're in your thyroid, your ovaries, your uterus, your skin, your brain, your liver, your muscles, and everywhere else in the body. When iodine levels are saturated, iodine tissues are saturated, there's about on a 50 milligram loading test, you'll pee out about 45 milligrams or 90% of that. And 5 milligrams will hang around and replenish, daily usages of it.
Mm-hmm.
So when you're more deficient in iodine and you take a 50 milligram loading test, I'm just throwing out a number here, but let's say you pee out 25 milligrams of that 50. That means your body retained 50% or 25 milligrams of it. We would interpret that meaning your body's really deficient in iodine.
Okay.
And as you keep taking iodine in milligram doses, that 50% excretion will start to go up. You'll start to not hang on to 25 milligrams, you'll start to hang on to 20 milligrams and then 10 and then 5. And then you'll start to pee out more iodine because you don't need it.
Right.
So that's how the test works.
Okay. So I can see where that wouldn't work so well with the 200 because then you just don't know.
We don't know because we didn't do it that way.
Right. But you've done enough work with those people on 200 to know, listen, you need it and you need a higher dose because we're trying to do something much larger here than just support the body. We're trying to shrink a nodule, a goiter, a tumor, a cancer, whatever it will be to require those higher doses.
That's correct.
Yeah. Yeah. Okay. Perfect. Now, yes, into the types of iodine. You said that you were doing things wrong that Guy Abraham said, let's change this up a little bit. So what were you doing wrong, or what are you doing today, and what types of iodine do we need?
So what I was doing wrong the first 8 to 10 years, I would try iodine in low, medium, and high doses to see if I could get the thyroid working better without having to use thyroid hormone. And it didn't work. Now, nobody got worse. They just didn't get better. Mm-hmm. I didn't understand iodine. The literature on iodine is very confusing unless you sit and study it. And I did not understand that there were different forms of iodine. I didn't understand reduction and oxidation. And so there's two major forms of iodine in the human body: a reduced form iodide and an oxidized form iodine, DINE. And different tissues of the body preferentially take up iodide and iodine. So if you want a whole body effect with iodine, the best whole body effect, why would you use iodide alone? Or why would you use iodine alone? Iodide is primarily taken up by the thyroid, iodine taken up by the breasts. So the types of iodine. So I didn't really know that different tissues concentrated iodine or iodide. And when I met with Dr. Abraham and I told him I was frustrated with iodine, he said, well, have you been testing people? No. And I start testing with him, and he sets me up as a lab to be able to test iodine. Tested a few hundred of my patients. They're all low. Now that I've got a test, why isn't it working? It's because I wasn't using a combination of iodine and iodide. And once I started using that, then I saw the results with it. And so when we say 50 milligrams or 25 milligrams or something, you and I are both talking about a combination of iodide and iodide, such as in Lugol solution, which was formed by Dr. Lugol in the 1800s, or tableted Lugol solution, tablets of combinations of iodine and iodide. Mm-hmm. The individual forms there's supplements out there that just have iodide or iodine in it solely. I can tell you they don't work as well, by far.
Okay. Yep. We've seen them all out there. I mean, there's so many supplements out there to choose from, but just having that guideline alone to look for both forms is key. So I love that. And when we're talking hormones, I want to kind of transition to your dad and go back to that, because you talk about the importance of testosterone with him as well. And I'm always touting the importance of testosterone. So how important is iodine for hormonal balance? Does that play a role when we're talking hormones?
Well, as I mentioned, I think at the beginning, you can't make a hormone in the body without adequate amounts of iodine. Mm-hmm. And so every gland needs it. And that includes the adrenals and the sex glands and the pituitary and hypothalamus. So sure, iodine is essential for that. This is why in our country we're seeing such a hormonal mess right now, and because iodine deficiency is so rampant. Mm-hmm. And it's look, if the government came to my office, which they have done, and if they tell me they don't like what I'm doing, which they have done, and they furthermore tell me you can do one thing only. Got to get rid of everything else and go back to conventional medicine, I would say, which they haven't done. Right. I would say iodine. I would take iodine with me, and if I had to forego the rest of it, I think that's the biggest bang for the buck. Price wise, it's not terribly expensive. Right. And every cell in the body needs it, and it's a really pretty cool thing.
No, I've said that as well. If you told me that I could only pick one supplement, because we all know I have like 50 to 100 in my supplement cabinet that I rotate around. But if I could only take one for the rest of my life, it would be iodine. It just would be. Now, you do hormone replacement therapy too. So you're not saying, and I just want to clarify this with people, we're not saying, okay, throw out your hormones, throw out your thyroid medication, just take iodine. You're talking about a comprehensive treatment plan that, you still might need some thyroid hormone. You still might need those bioidentical hormones, but you have to have the iodine in place for everything to work together.
That's correct.
Right.
And as I said earlier, iodine should be part of a holistic treatment regimen. It shouldn't be used as a standalone therapy to get the best results.
Exactly. Last question for you, because I see a ton of, well, maybe two more questions. Immune system. We talked about Hashimoto's. We know that's autoimmune thyroiditis. So we know that to even help any kind of autoimmune disease, we want to support our entire immune system. So I want you to talk about how iodine does come in. I always tell the story, and I believe I read this in your book. World War II soldiers would carry around iodine. Okay, you got a wound, take iodine. Are you sick? Take iodine. It's basically for everything, including our immune system, right?
Well, iodine was the most prescribed medical item before patent medicine took hold. And that includes the 19th century and then the early 20th century. Once they iodized salt, that's right around the time patent medicine took hold. There was just no interest in iodine. It just died at that point. And so there's no virus, bacteria, parasite that's been resistant to iodine. That's why if you're going to go through surgery, they'll clean your skin with iodine. They used to do that. Now they use this chlorohexidine now. I got to go to the Red Cross to donate blood periodically, and they start bringing that chlorohexidine stuff. I'm like, no, I want iodine. They can clean my skin with iodine. So they still have it there if you ask them for it. And hospitals still have it too, and they still will use it. But that it's a great antiseptic. And then in our body for the immune system, iodine's needed to activate the white blood cells to fight infections. So if you don't have enough iodine, the immune system doesn't fight as well. And I think that it's one of the reasons COVID was such a mess in our country, that because so many of us are iodine deficient and our iodine levels have been falling, along with a few other things too. But it's vitally important for the immune system.
Well, I know whenever I'm getting sick, or even if I'm traveling and I know I'm going to be exposed on a plane, I'll take extra iodine, and I'll also put it in a little nasal spray bottle and squirt it up my nose as I'm on the plane. I don't know if I'm doing any good or not, but I'm just thinking it's getting in there and it's going to kill any bugs that try to work their way up my nose, I guess.
Look, during COVID, there's been a couple of studies showing that people who use nasal sprays with dilute iodine, did much better and cleared the virus much quicker. In our practice, we've been having for 30 years, having people nebulize a dilute solution of hydrogen peroxide and iodine combined. So they're breathing it through a mask. So they're getting it in their nose, they're getting it in their mouth, and they're getting it in their lungs. That has worked perfectly. That was our best therapy for COVID.
Oh yeah, I was doing that too.
That was our best therapy that we did, was that.
Yep. Amazing. Okay, I could talk to you forever, but last question. Salt. So you mentioned salt multiple times, and there is a connection, just like you said. Iodine is responsible for, or important for, every cell in the body. Now I'm going to bring in the adrenals, because many hypothyroid patients point to their adrenals. They'll say, I have adrenal fatigue. My adrenals are shot. Maybe they are, maybe they aren't. Maybe you just need some more salt and iodine, right? But how important is salt to use with iodine? Do you recommend a salt loading protocol, and then tie that back to the adrenals, which also need sodium and iodine?
So in the halide, there are four halides. Two are essential: chloride and iodine. Our major source of chloride is salt, sodium chloride. And we can't live without chloride. So when we talked earlier, I said that iodine is moved from a low concentration in the bloodstream to a high concentration in the glands of the body, the thyroid, ovaries, uterus, and so on. And you need 2 atoms of sodium to be able to get that taxi cab moving iodine across the membrane into the thyroid or the breasts or wherever it's going to go. So you need adequate amounts of salt. So salt's been a mainstay of my practice for 30 years. If you check sodium levels in the blood work, the reference range is like just too big. It's too big. It should be like this. But actually it's like this, and it should be like this.
Yeah.
So optimal sodium levels in my practice are over 140 milliequivalents per liter.
Yep.
And optimal chloride levels are over 103 to 105 milliequivalents per liter. Now, the ranges go much lower than that, but that's not optimal.
Right.
So when you take iodine, if you're full of bromide, which you are, if you haven't taken iodine and you're living in our world, it's how it is.
Yeah.
So when you start taking iodine, you're going to mobilize the bromide and move it out of the way, and your body's got to release it. Well, some people get sick from that. It's called a detox reaction or fancy term is a Herxheimer reaction. And bromide used to be a part of conventional medicines. It's still there in some asthma medications and some antidepressant medications have fluoride in them as a part of their chemical makeup. But it used to be a bigger part of medicines. Bromo seltzer. You don't look like you're old enough to remember bromo seltzer, but I remember the ads for bromo seltzer out there. And bromo seltzer was bromine, like the Alka-Seltzer now that you drink for upset stomach or something like that.
Yep.
So people get bromine toxic from all these medications they were taking. So the treatment when they show up in the ER, delirious, confused, and they would give them IVs of saline, sodium chloride, and the chloride the sodium would bind the bromide up and allow the body to excrete it much easier. And the chloride would help displace the bromide so the body could excrete it. And so when I put people on iodine, if they have what I consider a detox reaction where they feel lousy or, whatever, I have them stop the iodine, take a teaspoon or two of unrefined salt a day, and then go back to the iodine about 2 weeks later. I very rarely hear they still can't take iodine at that point. So I think salt should have a big play with it. I have a book, Salt Your Way to Health, that I wrote right after I finished my iodine book. And I think salt and iodine are, very close relatives of one another that really should be taken together.
Yeah, absolutely. Yeah, you need it. And I'm the same way. I like sodium levels above 140 because if it is your adrenals require iodine and salt to function properly. So sometimes it's not about taking an adrenal supplement.
Oh my God.
Sometimes it might just be simple.
I was at a lecture last weekend, and I mentioned that I don't want to mention names here. So I mentioned in my talk about this, and I was talking about COVID, and I said I was having people. One of the things that ended up in the hospital was COVID. The main thing there were two main things that put people in the hospital, or got them super sick if they didn't go in the hospital. One was they couldn't breathe, couldn't oxygenate, and two was they were dehydrated. So I told people from the moment they called me with COVID, they've been doing this for 30 years, that you got to keep hydrated and you got to have water and salt. You got to put salt in every bottle, glass, sip of water. There should be at least a pinch of salt in there to keep your electrolytes up. And so I was mentioning this, and I said, someone asked me about, well, everyone's saying about a low salt diet. I'm like, well, look, low salt diet is great for creating hypertensive patients because it triggers this reaction from the adrenal glands to release these hormones called renin, aldosterone, angiotensin, which are salt drives almost, not every reaction, but salt drives, you can't live without salt. And salt drives a tremendous amount of reactions in the body. And, there's this idea of a low salt diet. It's ridiculous. If you have congestive heart failure or kidney disease, you got to be careful with it. But if you have normal kidney function, you should be able to handle a lot of salt. And a low salt diet triggers these hormones that elevate, and they elevate with the idea of trying to get you to absorb more sodium from your gut and hang on, and not your kidneys not to release salt. And the consequence of that is they raise your blood pressure. Now you're eating hypertensive drugs to treat this hypertension that's secondary to these renin, aldosterone, angiotensin hormones that are elevated from low salt. So I treat most of my hypertensive patients, put them on salt, and I find many of them can lower their hypertensive drugs. Many can get off, and they're healthier for it. So I was on the podium with, I could feel the shaking of the head next to me as I was saying this, and whatever, but so be it.
Yeah. You're basing it in science and biology. It really is that simple. So to go down different rabbit holes, and like you said earlier, to argue avoidance of iodine, it doesn't even make sense. When you break it all down, it doesn't even make sense. So now what about those who have had their thyroid glands radioactive iodine or removed, total thyroidectomy, still need iodine, right? Because we're still talking about conversion of T4 to T3, and we're still talking about the importance of every other cell in the body as well.
So the highest concentration of iodine in the body is in the thyroid gland. The highest amount of iodine in the human body is I think it's in the fat cells. The muscles are number 2. The skin holds 20% of the body's iodine. The breasts and ovaries and uterus and the rest of the glands have high concentrations of iodine. The thyroid only holds, I should know the number. Of course, I wrote about it in my book, but I haven't looked at it in a while. The thyroid only holds, I think, 0.5% of the body's iodine load when the body's saturated with iodine. I might be off on that number a little bit, but it's a tiny amount, maybe 2%, something like that. So over 95% of the iodine in the body is not in the thyroid. So when people ask me what you just asked me, I usually respond with, well, do you have skin? Do you have liver? Do you have brain? If you got all those tissues, they need iodine too.
Right.
So no,
Right.
It doesn't. And not having a thyroid does not decrease the amount of iodine I give people at all, because there's not enough in there to really make amount-wise that big of a difference.
Well, and it's imperative for T4 to T3 conversion, right? And we see so many thyroidectomy patients, especially in conventional medicine, if they're not working with us, that they're put on T4 only after a thyroidectomy. And now you've just taken out the thyroid gland that converts, that holds iodine, that helps you convert.
Yep.
So it just makes sense. My God, if you're on T4 only, please take iodine, because now you have a fighting chance at converting that, right?
Absolutely.
Yeah. Oh my gosh, Dr. Brownstein, I could talk to you forever.
Either great minds think alike here, or feeble minds are thinking alike. I would hopefully we're the former, not the latter. But it's interesting when what I learned on that first meeting with Dr. Radke was just look at the biochemistry. When prescribing a drug, when prescribing iodine or thiamine or vitamin A or whatever, look at the biochemistry, see how that cofactor or that thing is going to interact in the body. Statin drugs, they poison an enzyme called HMG-CoA reductase. You look at that pathway, you see what's downstream from that enzyme that the statins poison, and you're thinking, that's not a good idea. I don't want to get rid of all that stuff down there. There's going to be problems. Right. And you don't need randomized controlled trials to look at the biochemistry chart and think and to hypothesize that there's going to be trouble poisoning that enzyme. And it's the same thing with iodine. Just look at, like you said, look at T4 to T3 conversion. Look at how thyroid is manufactured. Look at how all the hormones are manufactured, and look at how the white blood cells fight infection. With iodine, it's a very essential item that we need, and we shouldn't be scared of it when it's used appropriately. And there's no reason to be scared of it. It's what we need. And the iodophobic individuals out there, as Ricky said to Lucy, explain that one to me, how iodine levels have fallen 50% over the last 4 decades or so, 4 to 5 decades, and the skyrocketing cases of all these breast, ovaries, uterus, thyroid, pancreas, whatever, if I missed any, I apologize, problems that are out there. Explain that one.
Yeah. I mean, there you go. Bam. Just like that. Mic drop. Right? That's just it. Oh, Dr. Brownstein, I love you to death. I can't thank you enough for being on here. Now, we're going to put all of your links to where people can find you in the show notes, your books, everything. But I want to mention you and Dr. Lindsay Berkson are doing a collaborative CME training, really deep diving into iodine and hormones and all the things at the end of April. So anyone that's listening, from DO, MD, NP, PA, nutritionist, I mean, whoever, I want them to listen up.
We're going to make it easy. Look, I write my books so doctors can get something out of it and lay people get something out of it. This seminar is going to be the same way. My feeling is if you can't make people understand it, either you don't know what you're talking about or you're hiding something. That's been my view when I've heard medical lectures over the years.
So you're offering CMEs to those who need it, but even the layperson can jump in and take this training.
Absolutely.
Oh, that's beautiful. So we're definitely putting that link in because I'm super excited for it. I think it's absolutely amazing. So we'll put that link in the show notes if you're listening to this after April. When is it running? End of April?
Last Friday and Saturday in April.
Okay. April 2024. So if you're listening to it after that, sorry. But for anybody that's listening before that, my goodness, sign up, because this is going to be more information in a short amount of time that you could get in reading 10 different books, especially with these two of my favorite people are teaching. You and Dr. Berkson. I love you both to death. So thank you. Just from the bottom of my heart, thank you for your time today and for coming on. This is information that needs to be out there. It needs to be out there.
Thank you for having me, and let's do it again.
Oh, anytime. Absolutely anytime.